The 16th of May, 2024 at 4 p.m. In terms of roll call, Alderman McMorris.
Here.
Alderman Montgomery.
Here.
Councillor Lillian Barr. Councillor Jason Barr. Councillor Boggs.
Apologies.
Councillor Deeney.
Anshaw.
Councillor Devine.
Anshaw.
Councillor Donnelly. Councillor Alex Duffy.
Shaw.
Councillor Sandra Duffy. Councillor Heaney.
And Shaw.
Councillor Hutton.
Anshaw.
Councillor McDaid.
Here.
And Councillor Tierney.
Here.
Thank you, Chair.
Thank you, Seamus. Members are all very welcome to May's meeting of the Health and Communities Committee. The next item on the agenda is the broadcasting statement. So I would like to remind everyone present that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. If you're seated in the lower public seating or media areas, it is possible that the recording cameras will capture your image, and this will result in the possibility of your image becoming part of the broadcast. By entering the council chamber and using the press or lower public seating area, you're consenting to be filmed and consenting to the use and storage of those images for broadcasting or training purposes, and also making keeping those images for historical records and making those records available to the public. If you wish to avoid this, you should move to the upper public seating area. A copy of the council privacy notice may be found on the council website at derrystrabane.com. Members, item number 4 is declaration of members' interest. They can be heard now or as they arise throughout the meeting. None at this stage. And item number 5 is our deputation for today, and we have the Juvenile Diabetes Research Foundation representatives with us today to talk about type 1 diabetes. As is normal, we'll have a short presentation with an opportunity for questions and answers thereafter. And I would like to hand over now to Adele Irwin, who is the Community Content and Information Lead. Adele, over to yourself there. Thank you.
Hello, thank you for bringing us onto council today to talk about type 1 diabetes and the exciting technology updates that we have coming with hyperclosed loop. So if you want to do the next slide, yeah. So today we're just going to talk about JDRF, our type 1 diabetes charity, about type 1 itself, about hyperclosed loop and what it would mean for the type 1 community here, and answer any questions that you might have after it. So I just wanted to introduce JDRF. We are the leading global organisation funding type 1 diabetes research. Our strength lies in our exclusive focus and singular influence on worldwide efforts to end type 1 diabetes. So we work with UK government's 2 major funding bodies, the Medical Research Council and the National Institute of Health Research, to make type 1 diabetes research a priority. We work with government departments to help them understand the impact of type 1 diabetes on the UK and the excellence in research that the UK can provide to the global mission to cure type 1. If you just want to move on to the next slide, thank you. So JDRF's vision is a world without type 1 diabetes. JDRF's mission is to improve lives today, tomorrow by accelerating life-changing breakthroughs to cure, prevent and treat type 1 and its complications. To achieve our mission of eradicating type 1 diabetes and its effects for people in the UK, we drive research to cure, treat and prevent type 1, accelerate access to type 1 treatment technologies and medicines, support people living with type 1. The more excellent type 1 diabetes research we can get funded, the quicker we can drive developments for our community. So next slide, thank you. Type 1 diabetes affects over 400,000 people in the UK. It can be life-threatening and affects all aspects of daily life. Type 1 diabetes Type 1 diabetes occurs when the immune system malfunctions, killing the cells that produce insulin, the vital hormone needed to turn glucose from food to energy. Without insulin, a person dies within a few hours or a few short days. That's the reality of type 1, not that they can manage their diet or, you know, they've had too much sugar when they were younger. That's the reality of living with type 1. The next bit we have is a video around hybrid closed loop. It's one of the new technologies that help people manage their day-to-day life. It doesn't cure type 1, but it just makes it a bit easier for people to live with it. So this presentation will help explain hybrid closed loop and what it can do for people with type 1 diabetes. If you want to play the video. Oh.
Is the video not coming on? No. Look, Adele, we can forward the video to members of the committee afterwards if you just want to continue on, if you don't mind. Thank you.
I can give a short explanation around hybrid closed loop if that suits a wee bit better and you can watch the video. I'm not going to explain it as well as the video will because it breaks it down and makes it you know, a bit easier for people to understand. But basically, hybrid closed loop technology, also known as the artificial pancreas, is to be made more widely available on the NHS in England and Wales for the first time, transforming lives of many people living with type 1 diabetes. It comes as the National Institute for Health and Care Excellence, NICE, releases new recommendations for the use of hybrid closed loop following years of research and advocacy work by type 1 diabetes charity JDRF. Hybrid closed loop is a proven treatment at the frontier of health technology, which takes a continuous glucose monitor, a CGM, and introduces an advanced algorithm to automate the delivery of insulin through a pump. It becomes more effective over time, delivering personalised medicine and transforming the lives of those who use it. Living with type 1 diabetes is relentless and requires intense management 24 hours a day. Hundreds of individual treatment decisions must be made around the clock as extreme blood glucose highs and lows can be fatal. By automating what is currently a manual process, hybrid closed loop can lift the relentless burden and risk of burnout. So what would this mean to people living with type 1? Living with type 1, as I said, is relentless and requires intense management 24 hours a day. Hundreds of individual treatment decisions must be made around the clock. Hybrid closed loop can lift this relentless burden and risk of burnout. And not only does hybrid closed loop make day-to-day life easier, it also enables people with type 1 to live healthier lives without fear by reducing the risk of complications, including heart failure, loss of limbs, kidney failure, and sight loss. That's how that's the reality of type 1. You know, that's what people who can't get this treatment, who can't access pumps, who can't access CGMs, that's the reality of what they're looking at when they're Googling something on the internet, or, you know, they're getting hit with this information around type 1. So I think next slide. So what this would mean locally. So I will pass over to Gail to talk about our local.
Hello, thank you for inviting us here to talk about access to hybrid closed loop technology and specifically about the T1 Club. The T1 Club is a local peer support social group made up of families living with type 1 diabetes in the Northwest. It was a very simple idea. It was just getting families together, meeting up, going bowling, meeting socially, just to make the burden of living with type 1 diabetes that bit easier. Just my story here, as you can see, Adele very kindly put a lovely picture of me and my daughter. I don't think my daughter was very happy if you knew the pictures here today, but this is my daughter. She was diagnosed with type 1 diabetes in 2016, and we spent 7 days in hospital being taught how to do finger pricks, injections, and carb counting. To say it was overwhelming is an understatement. We had no family history of type 1 diabetes. But as we left the hospital, I made a promise to my daughter that I would do whatever I could to make her life as good as it was and not to miss out on any opportunities. And that's where technology and diabetes has been amazing for us. So we've embraced all the technologies throughout the years, and today I'm one of the lucky ones sitting here, and we actually use hybrid closed loop technology. My daughter has an Omnipod 5 and a Dexcom 6. It really has just transformed our lives in terms of controlling the type 1 diabetes. It also helps me significantly stop nagging my daughter and continually asking what her blood sugars are, and I can ask her how her day was at school rather than asking what was your blood sugars, how was your diabetes. But I'm also here today representing families in the T1 Club. I think in our WhatsApp page we have over 100 people on that page. It's a huge issue, and the numbers are just increasing who are diagnosed with type 1 diabetes. So, you know, I said earlier, I feel so lucky to have hybrid closed loop, and that kind of makes me sad in a way, because I don't think we should feel lucky here in the Northwest to get that technology, which really does transform diabetes care. And I love supporting people in their journey to get hybrid closed loop through the T1 Club. I think, as Adele said earlier, hybrid closed loop is not a cure, but it does help. Everybody has to find a way. We are here to support and the T1 Club families to try and get the best outcome for the children. You know, we get great support from the hospital, but you know, it's that understanding in schools, early year providers, communities, to embrace also the technologies and improve the outcomes for our T1 families here in the Northwest. I think that's us covered now. If anybody has any questions, we're more than happy to take any questions.
Here we are, folks. Thanks very much for your presentation. Apologies that we couldn't get the video played, but we will ensure that it's sent out to the members of the committee in due course. Members, we're going to open it up across the chamber now to see if there's any indicated speakers. Councillor Hutton.
Thank you, Chair. And thanks, Gail and Adele, for coming in today, and thanks for the presentation. As you will have been aware, there was a motion brought on to Council at the last full Council in relation to the hybrid closed loop, and it's to assure you that you do have Council support in relation to lobbying to get that afforded to everybody that deserves it here in the North. A colleague of mine, Grace Nealis, had spoke at that full Council meeting, and she was very open about how diabetes type 1 has affected her family, and that there's so many of her brothers and sisters that are affected by it. And it was clear that the type 1 diabetes, it causes lots of problems, particularly in young children, as you say. And if a child is diagnosed with type 1 diabetes, it's important that their life remains stable, and it's made as easy as possible to manage that condition. She was also mentioning that the stresses that it puts on our maternity services, our neonatal intensive care units. So across the board, it is a no-brainer that this hybrid closed loop is something that needs to be in everyone's life that is diagnosed with type 1 diabetes. So on behalf of Sinn Féin, I just wanted to thank you for coming on today and to reassure you that you have Council support in anything that you will be doing in relation to lobbying, and we will certainly be doing that at our level as well. So thanks, ladies.
Thank you, Councillor Hutton. Councillor Barr.
Thank you, and thank you, Adele and Gail, for coming. And I just wanted to really echo what you have said, the support that the organizations that are working in this field provide. I had the opportunity of attending a workshop with Diabetes UK last year, and I realized just what a minefield it is when it comes to knowledge and information out there. And it's so important that organizations like yours are supported. I just had a question, and it's in terms of statistics. I say in your presentations, it is 400,000 people in the UK. Do we have the correct statistics for Northern Ireland and the Northwest? And what, in your view, what programs can council do to help with the information, but also reaching a wider audience? Because I don't have any family member with diabetes, so we don't have the experience. But I found it so important to understand, because you come across people in your walk of life and in your work that have diabetes, a type 1 diabetes. How can you help them? So what programs can we do in council to support your work?
Thank you, Councillor Barr. Alderman McMorris, and then I'll allow the speakers then to address all questions. Alderman McMorris.
Hello there, and thanks very much for coming along today, Adele and Gail. As Aisling said, Grace at the last meeting basically gave us a really powerful, I suppose, her experience of having type 1 diabetes. And I also have a family member with type 1 diabetes, and who also has been able to avail of the technologies afforded to him, you know, and it has made a massive impact in their life. As you say, you're not getting up in the middle of the night to test bloods, and, you know, you're not worried when you go away on holidays, have you enough insulin with you? Or, you know, there's all sorts of things that affect their day and daily life that people that don't have diabetes don't have to think about. So again, on behalf of the DUP, we will also support any initiatives or anything that you can bring forward that council can help. And, you know, we really admire the work that you are doing. Gail, I really want to wish your daughter well, and I hope she continues in her journey to basically having really good health and living a normal life, as normal as it can be for somebody with type 1 diabetes. But I suppose I don't really have much of a question. Just I really admire, you know, what you're doing and this support network that you're giving with families, especially for children. And, you know, because, you know, sometimes they don't understand what's happening to them, you know, and it's a life-changing process for a child to adapt to having type 1 diabetes. And the technology is just a small part of allowing them to have like a normal life. I say normal life, they have a normal life, but it's just a different normal, if you know what I mean. But well done, and I really thank you for coming along today, and I look forward to the video. Thank you.
Thank you, Alderman McMorris. I'm going to take our final indicated speaker now, Councillor Donnelly, and then I promise I will come back to you to give you an opportunity. Councillor Donnelly.
And apologies first for being late. I had the pleasure of representing council on Saturday morning at an event organised by Adele and her team in McGee, and I have to say I found it very, very interesting. The speakers that were there were, I think it was Dr. Kieran Walsh and Dr. Neil Black, and particular Dr. Walsh has type 1 diabetes, and he explained that how the difference that the technology has made to his life, and you could just see you could feel the difference that this had made. And I think that this technology, should be available to everybody. And since that conference, I have been contacted by people who and I've spoke to Adele about it, and they're looking to see, can their children or can their son have access to this technology, and the best way to go about it. I think that, that hopefully that this technology will become available to whoever needs it, and that finance shouldn't be a barrier, and that it should be prioritized so that people can have some semblance of normality in their day-to-day living. And when you hear that firsthand from somebody, from a pioneer of in the fight against diabetes, and they talked about it, a cure, or it's a cure, or it's not a cure. It's not actually a cure, but you limit the damage and the restrictions that diabetes puts on you, and learn to live and adopt your lifestyle. So I'd like to thank both Gail and Adele for coming here today, and no doubt that I'll be in touch as we go on here, because as I say, following that conference, people have approached and are looking for information and looking for contacts. Thank you.
Thank you, Councillor Donnelly. Over to yourselves, Adele and Gail, to answer some of those questions. Thank you.
Well, I suppose I can answer the question for the statistics in Northern Ireland. I thought it was 12,000, but Neil Black, when he was speaking on Saturday, said it was 16,000. So I will go with whatever Neil Black says, because he's the man that will know. So that's our statistics. I mean, I'm sitting here and I work for JDRF, but my backstory is I have a son who is now 17. He's had type 1 diabetes since he was 7. Unluckily, Gail's daughter has access to hybrid closed loop and all the things that come with it. My son doesn't. He is on injections. He uses CGM, but he uses injections. So I work for a UK charity that highlight, and they're talking about all these things that have developed over in England, and I'm sitting over here in Northern Ireland, and my son has not got access to the things that I'm fighting for other people, which is, so that's kind of why the T1 Club started and why I ended up getting involved with JDRF, because I know the fight that people have. My son has it. There's so many adults that have type 1 diabetes that don't have access to pumps, let alone have access to hybrid closed loop. So, I mean, we're so far behind that we need strong voices over here to help push. So that's kind of why I got involved, and because I have a bit of a strong voice, I suppose. So I mean, council, any way that you can help. I mean, even to come here today and be able to talk about type 1 and but bust some of the myths around it, that it's not anything to do with diet. It's not anything. It's not type 2. This is an autoimmune disease, and their pancreas is shut down, and without getting insulin into their body, these children, these people that have developed type 1, they will die. That's the reality. So even being able to share that bit of information so people know the difference between type 1 and type 2 it's brilliant to be able to do that. And I mean, even to highlight the work that we're doing locally, any lobbying that we're doing, and we try and share as much information about type 1 as we can. So anything at all, we will take any support that we can get, especially when we're trying to enact the same things that are happening in England and get them over here, so the people over here can benefit the way that I've seen people benefit over in England, because of a really good healthcare professional who's in charge of the NHS England, Partha Kyar, who is doing really good work. And I mean, if we could get a Partha Kyar over here, I think we'd be in a different playing field completely. So do you want to?
No, I just want to thank everybody for their well wishes in terms of our journey with type 1 diabetes. I think, our journey's not over yet. The technology is great, the hybrid closed loop's great, but at that conference as well on Saturday, everybody else is thinking about the next piece of technology. So it's just a constant evolving piece of work. So any support we can get from the councils of moving forward. Technology in terms of type 1 diabetes has moved so fast since my daughter was diagnosed. She started off doing finger pricks. We were doing 8 to 9 injections a day at one point. So even to go to a scanner, which scanned their blood sugar, was amazing at the time. So the technology nearly every year, Adele, is just changing and evolving, and we're getting closer and closer to a cure. So any support at all we will take, and thank you very much.
Thank you very much, both of you, for coming here today and for giving us that very valuable information. I have a father who lives with type 2 diabetes, so I know some of the complications that diabetes can cause. But I think, Adele, you said was the Mythbusters was busting them today was, I think was informative for me, and I'm sure for everyone else as well. So whatever we can do as a committee and as a council to try and help and support the work that you are doing, we will absolutely do that. And as all others have referenced, there's been notices of motion that have gone through this council, which thankfully had full council support to try and back up some of the stuff that you are doing. But anything that we can do as a committee, we're more than happy to put our shoulder to the wheel to try and help people. Absolutely. But look, on behalf of the committee, thanks very much for coming here today and for sharing that information with us. Thank you. Okay, we're going to continue on with our meeting, and you can get out and enjoy the sunshine. Or you're welcome to stay if you so wish. But I'm sure you've got better things to do. Members, item number 6 is chairperson's business. No one has contacted me in relation to chair's business. And I do have a few issues myself that I would wish to raise. And members, as you may know, this is Dementia Action Week. And I feel that it's appropriate to raise awareness of the issue for those living with dementia and their carers across this council area. I think it's alarming that over a third of people who are living with dementia across the north have yet to get a formal diagnosis. And in some parts of the Western Trust, I understand it's nearly 6 years for a person to get their first appointment. Too many people across the north are waiting too long for memory clinic appointments, and unfortunately, even when a diagnosis does occur, the type of dementia that the person has isn't recorded by the Health Trust. The reason that it's important that it's recorded by the Health Trust is because potential new drug treatments for dementia are now awaiting approval, and they're specific to the type of dementia that the person may be suffering for. I think it's essential that the Department of Health tackle waiting times and can in future give a breakdown of various types of dementia affecting patients. And I would ask the committee to consider the proposal that hopefully will appear on the screen shortly. And it's the right to the Minister for Health urging that his department tackle waiting times for memory assessment clinics and prepare new dementia disease modifying therapies by recording the number of patients diagnosed with dementia breakdown by dementia type. And I'll leave that there, folks, if you just want to get a wee look at it first. Alderman McMorris, you wish to speak on it?
Thank you, Chair, for bringing this forward. As many of you know in this chamber, I nurse my mother who has dementia, and she's got a Lewy body, which is like a complicated dementia. So this is really something that's close to my heart. So I'm not going to speak on it because I do get emotional about it. But thank you for bringing it forward, Brian. Really, really appreciate it, and very, very supportive. Thank you.
Thank you, Alderman McMorris. Councillor Heaney.
Thanks, Chair. And it's like Neri, my father died from dementia last year, so I'm sort of very familiar with the disease itself, and so on behalf of Sinn Féin, we fully support your proposal.
Thank you, Councillor Heaney. Councillor McDade.
Thank you, Chair. I'm happy to second the motion if you need a seconder. I think, as everyone said, I don't think anyone will disagree with this. It's necessary, and it's a disgrace that people are experiencing symptoms and actually never getting a diagnosis. They're dying before they get their diagnosis, so something needs to be done. Thank you.
Thank you. Did you want back on again? No. So, members, Councillor Donnelly.
Chair, no, just the give my put on record my
Councillor Donnelly, would you just mind speaking on the mic?
sorry
Some
no,
issues with not hearing it on the recording previously, so if you don't mind.
apologies, Chair. No, just they put on record my support for the motion or the proposal here. You know, it goes without saying, and you know, it's a horrible sickness, and it can be very not only on the person who has dementia, but the loved ones. It can be very, very difficult. So just content to support the proposal. Thank you.
That's great. Thank you, folks. That from what I'm hearing, everyone is supportive. And thanks to those who have agreed to second it. I think it's fair to say that has passed with full support. Members, this is the last, you'll be glad to hear, the last meeting of this committee that I'll be chairing for a while. And I just want to pass on my thanks to all of the members who have been in attendance at this committee throughout the past 12 months for how they have supported and allowed me to deal with the business of this committee and getting plenty of work done throughout the year. I also want to thank the officers for the support that they've offered me in trying to get through the work that we have done. And I think anyone who looks at the work that this committee tries to cover will see that this committee leads, in my view, and shows our commitment as a council to communities right across this district. And I'm very proud to have chaired it for over this last 12 months. And I want to pay special thanks to Councillor Donnelly as the Vice Chair for stepping in for me on a number of occasions when I was unavailable. Your support has been greatly appreciated as well, so thank you for that. Members. Councillor McDade.
I just want to thank you. I just want to say thank you to Councillor Tierney for being a great chairperson and Councillor Donnelly for being an even better deputy. I think it's been my first year and it's been a great committee to sit on. I think it's been very fairly handled and everyone's been given an opportunity to speak. So now I just wanted to say thank you.
You watch yourself. Councillor Heaney.
Thanks, Chair, and summarily, on behalf of our team, I just want to thank you for your years, Chair. You've been very professional and fair to all members, so thanks very much for your time.
Alderman McMorris. Thank you, Conor. Thank you.
On behalf of myself, Brian, I'd like to thank you also for your tenure as chairperson. You've been very fair and certainly you've had to be robust at certain points of the meetings and you always did that with dignity and I just really appreciate all the work that you have done regarding that, and also to the Vice Chair, put on record our appreciation for him as well. Thank you.
No worries. Thank you, Alderman McMorris. Councillor Donnelly.
Very good, Chair, and thanks for the appreciation. And Chair, now I want to put on record my appreciation to yourself too. I think you're a better person when you're up there chairing things than you are when you're down here. That's a compliment. No, but I think you've been very fair and decent, and I'd also like to put my appreciation for the officers too, and fellow councillors and aldermen. I think this is one of the better committees that I have been on, and I think people, because of the seriousness of the issues and that, it's one where we seem to be, there's more harmony and people work together. So I just want to put my appreciation for all the members and the staff. Thank you. And for the lifts to Strabane and the lifts from Strabane. Thank you.
Thank you, everyone. He's only saying that because he knows that I can't fight them when I'm up here, and I can make a better fuss of it when I'm down there. Alderman Hussey.
Thank you, Chair. On behalf of the guests who appear now and again at this committee, can I add to the thanks to yourself? And I do concur with Councillor Donnelly. You're easier handled up there. But as others have said, you've handled the position with fairness and firmness, which is to be welcomed as well. So thank you, Chair.
Thank you, Alderman Hussey. I'm not sure whether that's a compliment from you and Councillor Donnelly or an insult, but I'll take it any which way. But look, and everyone, I appreciate everyone saying that I've been fair. I'm going to be slightly unfair now and break my own rule. As people know, it's normally 24 hours for chairperson's business, but Councillor Duffy has sort of indicated, and given that after this meeting you can't kick me out anyway, so I'm going to come to Councillor Duffy for chairperson's business. Go ahead.
Good Chair, and I haven't got a proposal or nothing really, it was just a question, and I thought I would take the opportunity when everybody's been nice to you, because you're in good mood and all and smiling away at me, so no, it was just a question for Barry. Barry, just on the MAGA paper, for is a possibility it's going to come on June. It's just, as we know, it's time sensitive, the 6 months on it, if it'll be brought forward, and if so, if not, can we bring it forward?
So yourself, Chair, yeah, it's coming in June, committee.
There we are. Painless. Okay, members, no further items on chairperson's business. So moving on to item number 7. Sorry, there is one further point, and I'm going to bring Barry on this.
Thank you, Chair. It's just a brief update, members. You'll be aware that through the rates this year, there's an amount allocated to take forward the strategic leisure projects. Now, there'll be a detailed paper coming to members at the next committee on the 13th of June. And there'll be a members briefing on the 17th of June in relation to the Strabane build. So the designs for the Strabane build are further advanced, obviously, than Templemore. And we're proposing a public consultation, user group consultation around that. So we just want to give members a heads up. We'll be giving you detail around it, but we need a bit of time to write the sports clubs, user groups, the general pub, advertise all that. So we need 4 or 5 weeks. So just want to give members a heads up in case you're wondering what's this about. To be a detailed report and a briefing to members in advance of that consultation. So just as an information item. Thank you, Chair.
Thank you, Barry. Members, moving on, item number 7 is the matters arising from the special Health and Communities Committee meeting held on Tuesday, the 26th of March, pages 15 to 22 for matters arising. No. Okay. Moving on, item number 8 is the matters, and I apologise, members, I've forgot my glasses now. Struggling to see this paper, so just bear with me. Item number 8 is the matters arising for the open minutes of Health and Community Committee held on Thursday, the 18th of April, pages 23 to 42. Alderman McManus.
Thanks, Chair, for letting me in. I have 2 small items. You want me to just do the 2? Basically, the first one is HC 90/24. It was regarding the consensual grant making. I just wanted to ask the question, whenever we done the briefing on the consensual grant making, we were informed at that stage, sorry, do you want me to stop? No. We were informed at that stage that basically all of the organisations over the last 5 years would be written out to. I was just wondering, has that happened? Has that went out? Do you know, and what the kind of feedback was on that?
Through yourself, Chair. It's my understanding. I don't have the detail of all the local growth partnerships, but I know some of the growth partnerships have already had events and they have brought groups in that were funded. I know the Mirror, for example, took place a couple of weeks ago, just on the back of a conversation. So it'll be up to each of the local growth partnerships. Our officer team have provided a list of all the groups that have been funded and what the programmes were funded on. So that will be the plan. That's part of it in terms of the action plan come in before we bring in front of this committee that all groups need to be engaged with. So if it hasn't happened, it will be happening.
Has the list went to the group partnerships, or has council contacted the organisations?
The list has went to the local growth partnerships, but council has also contacted the groups to let them know the details around who to contact in the local growth partnership.
Yeah.
So it's a twofold approach.
That's grand. Second item is HC 92/24. It was in regards to the directed intervention. As you know, at the last Health and Communities meeting, with the directed intervention, I had spoken, says that we would be engaging with the local groups, being the bonfires, in order to engage in regarding getting things put onto that action plan. And as part of that process, I have started to engage with the bonfire in Drumahoe. Now, they have had no previous engagement before, so it's really good that they're now starting to engage with ourselves, and they're going to do some kind of joint up work with Irish Street and whatever, so regarding training and things. So it's really, really positive. But one of the things that came out of that, Chair, is basically I visited the bonfire builders on the site, and it's actually sitting on a children's play park, and there's already dumping and fly tipping there already. Now, I'm not bringing this forward because, I'm facilitating the bonfire in any way. I'm bringing it forward because there's a real health and safety issue in regards to the collection of wood and rubble and all the other stuff of we know the people dumping bonfire sites, and the children are just basically running through it. So basically, I had wanted to put a proposal forward, or a request forward, that basically could council put some kind of Harrisville fencing or whatever to secure the park area so that children are kept safe and they're not running through dangerous waste and all sorts of materials. So I just want to put that kind of request forward to see if there's something the council can do.
For yourself, Chair, I'll pass the request on, Alderman McMorris, to the Director of Environment Regeneration, Play and Parks and Open Spaces, their responsibility. So look, I'll pass that on. We'll get that as an action, and we'll be able to come back to you on that once they respond.
That's great. Thank you, Barry.
Thank you, Alderman McMorris. Councillor Heaney.
Thanks, Chair, and it's HC 82/24. It's about the Ballernet flooding. And it was just to take the opportunity to commend. Obviously, there was flood alleviation work done on my own DA at the Bywash. It had its first test last Sunday when we had a deluge of rain over the period of about 20-25 minutes. I was nervously waiting on my phone to start ringing, and thankfully it didn't. So it seemed to have passed that test, and I'm not looking to 10 fit. But you know, we're often quick to criticise DFI at times. So just when they've got something right, I think it also needs acknowledged as well, Chair.
No worries, Councillor Heaney. Thank you. Alderman McMorris.
Can I just make a comment on that last?
Yeah.
And just regard to the flood alleviation schemes for Eglinton and the Drumahoe area, we're still waiting for I suppose remedial action to come forward in regards to those areas. So it's good to hear that it's worked in that area. Do you know what I mean? So that hopefully gives me hope that some flood alleviation schemes could be adopted under these other areas and possibly work for them as well. Because I know they have a lot of issues with selling houses and all sorts of issues. But thank you.
No worries, Alderman McMorris. Thank you for that. Members, no further matters arising from that meeting. I'm going to move on to item number 9, is the rural support. Barry.
Thank you, Chair. Members, this is to seek your approval for the reallocation of 20,000 from the Rural Support Programme and the reallocation of 10,000 from the DFC Community Support Programme into Tier 1 of the Rural Community Centre Venue Fund 24-25. Members, you recall the report that was presented in April committee, highlighting the outcomes of the assessment process for the Rural Community Venue Fund. And you'll be aware the programme was again this year oversubscribed, meaning that more groups applied to the fund that could be funded. And there's an agreed process in place to allocate funding to those groups who have scored over the threshold should funding become available. Under the 22-23 financial year, the council ring-fenced a non-recurrent budget of 150,000 to assist rural communities building capacity. The 3 local growth partnerships have been working together and have approved 130,000 of the budget towards developing 22 rural capital projects. There's £20,000 of that fund that is yet to be allocated, and what we're discussing today. The concerns of inadequate rural infrastructure and capacity has been discussed by the members of the Rural Issues Group previously, and at the most recent meeting, members expressed an urgent need for adequate funding to support the rural groups in the delivery of essential services. So members, you'll see within Tier 1 of the Venue Fund, 10 groups have been awarded funding, with 5 groups who met the threshold held in reserve. And should further funding become available through the financial year, we could support them. 20,000 has been identified from the Community Capacity Support Programme, and 10k from the DFC Community Support Programme is highlighted. This will allow 2 of the groups held in the reserve list to receive funding of 12,000 each, and for 1 group to receive part funding of 6,000. Officers continue to liaise with other funders such as DERA and DFC to see can we get additional funding into the area. Members, just before I come on to the recommendations around this, the officer team met on the back of the comments from members at the last meeting, and it's clear that there's not enough in terms of in the budget for the rural area and the venue fund, and it is something we will be bringing a paper more detail hopefully before the summer recess, but certainly in the early autumn, how we're going to address this. I have brought it up with senior leadership team, and we'll be having discussions around rates. Can we get additional money in to the rural area and come up with a different model of allocating the funding? So that is something that we'll bring further reports back to members on. So in terms of the finance and the legal, members, the total allocation, proposed allocation is 30,000. It will allow 2 rural groups like Patrick, Dennett Interchange receive funding of 12,000. And the third group in rank of order of scoring is Derrick Valley Care, who would receive part funding of 6,000. The important point to note here, remember, this is a 3-year fund subject to letters of offer and money coming in from central government. This isn't a recurrent budget, so this would be only for this financial year for those 3 groups. And it's also anticipated, members, as you see in your report, that council would receive the same CSP funding in 24-25 as per a 23-24 letter of offer. So in terms of recommendation, that members approve the allocation of the 20,000 and 10,000 for the Tier 1 Community Centre Venue Fund, and that members approve the allocation as follows: like Patrick Development Association 12,000, Dennett Interchange 12, Derrick Valley Care 6,000. And again, members, that you note, if the allocation is to continue beyond this year, then there would be a budget pressure and rates for next financial year. Thank you, Chair.
Thank you. That's like somebody turned the light on when you wake up there. Okay, Barry, thanks for that. Alderman Hussey.
Thank you for the opportunity, Chair, and thank you, Barry. As you referred to in your own report there, this dates back to HC 89 in the previous minutes. And can I sincerely thank you for agreeing to meet with 3 of the impacted groups. And I think you've summed up quite well within particularly the background, the scenario that we heard from those groups and the implications of not being funded. The threat to our rural community infrastructure is real, and I think you will agree that those groups who did meet with ourselves and Barry, I think we can agree that they totally smashed it with regard to explaining the scenario that they were finding themselves in. It was going to impact on other projects that are important to this council, including Peace Plus, because the rural infrastructure, that community infrastructure, was being relied upon within the applications going in there. I do have to say it's disappointing that we're still 30k short. There are 2 groups who haven't, and 1 who hasn't received the full funding. But it is extremely welcome what is here reported before us. I do feel, you've mentioned also, Barry, there, particularly in the recommendations, there will be budget pressure coming 25-26. And I think that has to be taken on board. And the bullet bit that, if we need these services, they're going to have to be paid for. And it's going to have to be the ratepayers who are contributing towards the services that they are receiving throughout the area. So within the rates process, that is something that I trust folk can agree to going forward, because we see our rates money going left, right and centre. And I'd say this again, you know the score with me. The rural community sees our rates being spent within the urban areas, and the rural community simply want their fair slice of the cake. If that means that rates have to rise to in order that, because I'm sure the urban groups don't want funding taken off them to allow extra funding to the rural areas. But it is welcome, and I thank you, Barry, for what you brought to the committee. Thank you, Chair.
Thank you, Alderman Hussey, for that. Alderman McMorris.
Thank you, Chair, and thank you, Barry, for bringing the report forward. And I also met all 3 of the groups and concerned, as much as I'm an urban councillor, I have family members in the rural, so I have a connection there. But when I listened to the 3 groups, it was very evident that this was a case of no funding, can't open the doors, and and the work that they did and do in their communities is imperative to the rural community. So this is very welcomed, Barry, and thank you for facilitating and coming to meet with the groups as well. You know, it was a difficult conversation for them, and we're just pleased that, you know, funding has become available, and 2 of the groups will receive the £12,000 in totality. But we're also mindful that one of the groups is still £6,000 short, and there's also 2 other groups that it wasn't funded. But I appreciate everything in regards to this, and we always talk about disparity in the rural. Do you know, I mean, it is a case that we have to look in order to secure a ring fence money for the rural, so they don't lose the vital services that they have within the rural area. And we would be, as a DUP, very supportive of that. But thank you.
Thank you, Alderman McMorris. Councillor Devine.
Thanks, Chair. Thanks, Barry, for bringing the report to us. When we discussed the issue of the Community Centre Venue Fund back at a previous meeting in February, I had expressed my concerns there at the time that the fund wasn't sufficient to meet the needs of the venues that are operating in the rural areas, and the increased running costs that they've been hit with over the last few years. I'd asked at that, I'd put a proposal that options would be considered and how we might increase that funding. So Barry, thanks. I welcome the fact that a paper is going to be presented on that. I'd also asked we write to DFC, and I'm just wondering, have we had any response back in terms of that? It's clear that this funding is needed, and that the funding isn't, you know, the money that's available is not sufficient. And these centres provide really vital services in our rural areas where there are no council facilities. They're doing fantastic work in the heart of our communities, and it's important that we make sure that they are adequately funded. I would just like to be assured that the funding that is being located or transferred is surplus funding, and that there won't be any disadvantage to any other rural projects. And on that, you know, if that's confirmed, I'm happy to propose if it hasn't been proposed, or to second.
Thank you. I'll go to Councillor McDade, and then I'll allow Barry and then.
Thank you, Chair, and I'm happy to second if it needs seconded. I think that I'm not a councillor for a rural area, although I think part of mine does technically feel like a rural area. But I know from Alderman Hussey and Councillor Devine, I was actually going to mention about when you spoke a few months ago at Council, I feel like I do understand and have a feel for the disparity across the urban and the rural. And I think this is very welcome, and I would agree. I would like to make sure that this isn't going to take away from anywhere else. It's a shame that Derrick Valley Care have only got half the funding given the good work that they do, but I understand the process and that not everybody's going to meet the threshold. But no, I'm happy to second it if needed. Thank you.
Thank you. Barry?
Thank you, Chair. The answer to the first question there, DFC haven't responded yet, but you know, when we get that back, I'll let you know. The second one, yeah, in terms of surplus, you know, the money hasn't been allocated by the Rural Issues Group. We actually met with Rapid this morning, council officers in Rapid. So one of the key actions out of that, they're applying to a fund, and we would hope to be procuring a consultant to work with Rapid and council officers. I know there was a proposal brought in around mapping out the resources in the rural area. I've also asked Rapid, can they look at mapping, because there was discussion at the last meeting around the venues, mapping all of the venues, who gets what funding goes in. So that will form part of the paper that we'll bring back in the autumn time, how we take forward this, all being subject to having extra money, obviously. Because members, I think even the groups that were funded and have been scored highly keep coming back just to say that £12,000 isn't enough with rising costs over the last number of years as well. So we're going to take all of that into account, try and do a robust assessment, and then bring something back into members. Probably we'll need a working group at some stage around all of that with the rural council. So that's something it'll likely be the autumn into the winter time before we get that progressed. So hope that's answered all of the questions. Thanks, Chair.
Okay, Barry, thank you for that. That paper has been proposed and seconded. From what I can hear from the floor, everybody's supportive of it. I'm happy to move on, members. Yeah. Item number 10, Brian McBride, Brandywell Stadium, Barry.
Thank you, Chair. This is to update you on developments to improve accessibility at the stadium and to seek your approval to purchase required equipment at an estimated cost of £2,000. Members, you'll be aware of the motion at December committee. and officers were asked to explore whether the soccer site programme, which has been implemented at Windsor Park, could be introduced to the stadium. Officers have engaged with the RNIB, Derry City Football Club, the IFA and elected reps to discuss adaptations to the stadium. The team at the stadium, the staff have undergone the disability awareness training, and stakeholders have agreed that an audio service can be provided which is similar to soccer site while not being identical. The service will provide the same level of assistance to users and mirrors the soccer site programme, and as proposed, the council will cover the cost for radio equipment to enable this. The football club will organise the administration of the devices on match night, while Drive 105 have agreed to provide match commentary. So members, the recommendation that you note the content of the report and that you agree to the purchase of the required equipment at a cost of £2,000. Thank you, Chair.
Thank you, Barry. Councillor Hutton.
Thank you, Barry, for that report, and happy to agree to pay those fees for the transmitter. I've been involved in some of the conversations that have taken place with Drive 105, Richard Moore in particular, Rory from RNIB and Steve and that. So I'm absolutely delighted to see this getting over the line, and I have to commend council officers for getting it done so quickly. There's a lot of excited people out there who are visually impaired and are really looking forward to this new match experience. And I know it's not the same as the soccer site, but this is unique now to the Ryan McBride Brandywell Stadium, and it's great to see the local radio station being involved in it, because they are champions, or they champion Derry City Football Club at all times. So just to say thank you so much. Really excited to see this happening, and there's been a lot of people have contacted me in relation to if you need like guinea pigs to test this out beforehand. So please get in touch, because there are a lot of people that are really eager. I myself am really eager to see how it works. So thank you very much, and happy to propose the cost for the transmitter.
Thank you, Councillor Hutton. Councillor Barr.
Thank you, Chair. And just to second what you're saying, we're really happy to support this. I think any public services needs to be accessible for all. So anyone who is left behind, it feels really unfair for our community, especially those who are very interested in getting involved in this. So very happy to support it, and need to second it if you need a second.
Thank you, Councillor Barr. Alderman McMorris.
Just a quick to say, really glad that there's accessibility for everybody, and it's really important that we're inclusive in all our venues. So if this is something that can be looked at in other places, it'll be brilliant to roll it out. Thank you.
Well, I agree, Alderman McMorris. So that's been proposed by Councillor Hutton, seconded by Councillor Barr, and everybody seems to be supportive. So we're happy to push on. And item number 11 is yourself again, Barry.
Thank you, Chair. Members, this is to seek your approval to award SLAs to Foyle Search and Rescue, Newton Stewart Leisure Complex and Derry Healthy Cities for financial year 24-25. Funding for the 24-25 financial year for the SLA with Foyle Search and Rescue and Newton Stewart is included within the rates, members. Funding of 15k for the SLA with Derry Healthy Communities for 24-25 will be covered from identified underspends within the Directorate. It is proposed that the 15,000 to Derry Healthy Communities for 25-26 financial year, if it's going to go forward, has to be included in the rates estimate. So just in terms of the recommendation, members, that you note the content of the report and approve the strategic SLAs for the 24-25 financial year. Foyle Search and Rescue 15k, Derry Healthy Communities 15k, Newton Stewart Leisure Complex 37,500, and that members approve the ask of 15,000 for Derry Healthy Communities SLA to be included in the 25-26 rates estimates. Thank you, Chair.
Thank you, Barry. Councillor Hutton.
Happy to propose, Barry, the great work that's done with every one of those community organisations. So happy to propose the report.
Thank you, Councillor McDade.
Thank you, Chair. I just, thanks for the report, Barry, and your team, and I'm happy to second it as well. I think it's easy to, or simple to say, just they're all needed. So we need to keep up the service level agreement. Thank you.
Alderman McMorris.
Just echo that. That's it. Thank you.
Sorry, what?
I just echo what you just said.
Okay.
No sense of re-saying it.
Okay, thank you. So that's paper is agreed as well, proposed by Councillor Hutton, seconded by Councillor McDade. Item number 12, Seamus, is yourself.
Thank you, Chair. Members, the purpose of the report is to update you on the joint work between councils and the Office of Product Safety and Standards regarding construction products. You'll be aware of the problems associated with defective concrete blocks used in construction of properties across the island of Ireland. The report outlines Council's role in relation to consumer product safety, including construction products, and the role of the Office of Product Safety and Standards as the national regulator. Members, the report also provides information on research carried out to date regarding mica and sulfates in the concrete products which contribute to defects in these structures. The Environmental Health Departments across the 11 councils have participated in a task and finish working group to identify both the block making manufacturers and the quarries used to extract aggregates to make concrete blocks, and this information has been provided to OPSS to consider the way forward and help ensure concrete products manufactured in Northern Ireland are suitable for their use. Members, in the meantime, council officers will proactively continue to liaise with the 3 manufacturers within this council area and provide guidance on the relevant regulations. And the recommendation, Chair, is that members note the update and support continued liaison with OPSS.
Members? Councillor Heaney?
Thanks for the report. Seamus, no issues with that, so I'm happy to propose.
Thank you. Alderman McMorris?
Happy to second. Seamus, was there a visit done to the 3 sites? Was everything like okay? There was no mica or any issues with the 3 companies? Just a wee bit of feedback on that, just.
All right, no issues to date. Again, we're just liaising with OPSS in terms of the information that's coming forward as to the potential source of the defects. No, originally the conversation was around mica. That seems to have changed now to sulfates. So we're linking in with the manufacturers in terms of the up-to-date guidance and advice.
Okay, members, that paper has been proposed and seconded. No one speaking against it, so I'm going to assume that these are all content. And item number 13 is yourself, Seamus.
Thanks, Chair. Members, the purpose of the report is to seek your approval of the proposed marriage and civil partnership ceremonial fees. Members, the report sets out legislation governing marriage and civil partnerships, the approved venues in the council area, and which the district registers officiate, and the number of ceremonies carried out each year. The fee in question is the only fee set by and retained by council. All other registration fees are set by the General Registry Office. In terms of key issues, members, council's internal audit team have recommended that we review and undertake a scoping exercise in relation to these fees, as they hadn't been reviewed since 2015. So that benchmarking exercise has been completed, members, and you'll see in Appendix 2 the variances across the 11 councils. Although it's proposed to increase the fees by 20%, they remain marginally lower than many of the other councils. And Chair, the recommendation members approve the proposed fees.
Thank you for that, Seamus. Members? Somebody?
I'm happy to propose.
Opposed, Alderman McMorris, seconded, Councillor McDade. Everybody's happy enough? Okay,
Everybody
members.
just seems very terrified on the subject for some reason. The whole marriage thing, everybody's afraid to say it. Eh?
They were wise to save their money.
It's no coincidence that it's item number 13 in today's agenda anyway. Members, item number 14 to 20 are open for information. I'm happy to take them as read unless anybody wants to discuss one. Hands not all up now. First I seen was Alderman McMorris, Councillor McDade, and then Councillor Deeney, and then Councillor Devine.
This is just a quick question. I see in regards to item 14, the swimming profession. I was just wanting to ask, a while back, I can't remember the actual month that it was discussed, but we had spoke about the item about the city bass being like 6 days instead of 5, and there was to be a 3-month review on that. Has that review happened, or?
yourself, Chair, I think we agreed a 6 month. We would need 6 month review. So yeah, the team are working on that, and we'll come back in front of members.
Is that due now or now? Must be 6 months now, is it? That was November.
Yeah, we, through yourself, Chair, it was January really before we got open properly. You know, it was a soft opening pre-Christmas, so January. So it'll be the end of June before we have the full figures. And normally, you know, it takes a month after that, so it'll likely be the autumn before the paper will come back in front of members. It's doubtful we get it in June or July, just because there'll be more robust data coming back in. So that's something that we'll bring in, and we'll record it again as an action after today's meeting. Thanks.
Thank you, Alderman McMorris. If it's any help to you, I drove past it this morning at 5 to 10. There must have been 15 or 20 people standing queuing outside to get into it. And I'm not exaggerating. I was actually surprised to see it. But very.
That's really good. And you know, the fact that there is a lack of the learning thing for swimming, you know, it's good that they have that to avail of.
Absolutely. Councillor McDade.
Thank you, Chair. Agenda 18. It's just that's the agenda item about the remote registration of births and deaths in stillbirths. So everyone will be aware of the current paperwork being introduced in England for families experiencing miscarriage and baby loss before 24 weeks. And this is still nowhere near happening here. So I would just like to make a short proposal, which I have sent to Paula, just that we write to the Health Minister asking him for an update in his plan to introduce these certificates for people living in the North. I know that he has said he's in a process of meeting with stakeholders and looking at the process and everything, but I think it's something that we need to be kind of continuing to push. It's too important. There's too many families going through it that have been through it, and it's just heartbreaking. And if we were able to give them anything that make it feel like their baby was here and give them a bit of understanding that, I think would be important. So the proposal should be up there. Thank you.
Thank you, Councillor McDade. Alderman McMorris.
I'm happy to second that, and thank you, Catherine, for bringing that forward. I know Gary Middleton, MLA, spoke openly in Stormont regarding the same issue and spoke about his personal journey with birth loss. And I know his wife's a member of our council, so this is something really, really prevalent, and we would push for these certificates. It's really important to mark the basically people's wee babies.
Yep.
Thank you.
Fully agree. Councillor Deeney.
Just to put our support out there, it's obviously a massive issue. And as Councillor McDade has said, it means so much to people to have that certificate. So anything that we can do to get this pushed and quicker is so important. So Gurmaga, Councillor McDade, for bringing that forward.
Okay, that proposal by Councillor McDade, which was seconded by Alderman McMorris, I haven't heard anyone speak against it, and I sincerely hope that I don't. But are we happy to accept that has passed and Council will write to the Minister relating to it? Okay, thank you. Going back now to the matters for information, Councillor Deeney.
Gurmaga, Chair. So it's on the same issue as Alder McMorris has brought up. So it was just the need for extra provision for swimming. We know it's huge within our city and district, obviously, and particularly, as you stated, it's for beginners, children's classes. I know I'm contacted about these regularly, particularly in Foyle Arena. I understand the barriers here to increasing the swimming provision. And it's great, obviously, now to have the city baths, to have that extra swimming provision there. And obviously brilliant that we're able to keep it so affordable, as we know the health benefits. So as stated, also extra swimming slots become available with the new leisure facilities, hopefully in Strabane and Templemore. But it was just great to get this report to feedback to people the information who have been asking. So thank you so much, Barry, for that.
There we go. That's great. Thank you, Councillor Deeney. Councillor Devine.
Thank you, Chair. It's on item 16 and the Food Safety Standards Research Project. I'd just like to thank Council for the work that's gone into that research project. I think it's work that's very worthwhile. I would be interested to know how our council area compares with the overall findings of the report, if it's possible to get that. I think when you take the findings from this report outlining the lack of healthy food options that are available to our children in our food environment, along with the obesity figures. It goes for grim reading. 65% of our adults are overweight or obese, and 26% of our children, 25% in 2 to 10-year-olds. Obesity is associated with reduced life expectancy, not just shorter lifespan, but also reduced health span. It's a risk factor for a whole range of conditions, from cardiovascular disease to type 2 diabetes to cancer, liver disease, as well as mental health issues. And as well as the vast health consequences, there's also significant financial costs linked with obesity and associated conditions. It costs around 425 million per year in terms of health costs and loss of productivity. Obesity accounts for 85% of the risk of developing type 2 diabetes. And this takes up, type 2 diabetes takes up about 10% of our health budget. So this is a significant factor. It's complex, it's multifactorial, and I think we all need to take responsibility for addressing this growing issue in our society. It's not just a healthcare issue, it needs a multi-agency approach. I think the guidance from the FSA is helpful, but clearly we need to move beyond that and introduce concrete measures that can help alleviate this issue. Early intervention is really key, and we need to do everything we can to support children and families to make healthier choices and to make those healthier choices easier choices. We need to influence our food environment to make healthy food options available, to make them accessible, and to make them affordable. And I think this council also needs to do their part to promote and encourage healthy eating and to provide a healthy food environment. I've sent just a short proposal to Paula, and it's in relation to council assessing the food options that are available in their own facilities, including vending machines, to determine the nutritional quality of the food that they offer, because I think as a council we need to lead by example. I would also just like to ask, in terms of council, do they do any work in terms of with primary schools throughout the district to promote exercise and movement and enable children to sample different types of exercise? Now, I know it's a complex issue and it's not just eat less, move more, but I think these are two really significant issues in terms of trying to do something around this problem. Thank you, Chair. I know I'm pushing it in your last day.
No, you're all right, you're right. You're, Councillor Heaney?
Just happily second, Chair.
Oh, sorry, I thought you were looking to speak just. So the proposals before you, members, have anybody wish to speak to it, or? Councillor McDade?
Thank you, Chair, and thank you, Councillor Devine. I think that's fair enough. I'm happy to second that. I think that the report is for grim reading, but I wouldn't disagree. When you take Wayne's out to eat in Derry, it's chicken nuggets and chips, or sausages and chips, or pizza and chips. There isn't really anything else. Although it looks like a menu in my house at times too, but it's, I think that the more we can be doing to push healthy eating and healthy living from a young age, it's going to have a long-term impact. So I'm happy to second the proposal. Thank you.
Alderman McMorris?
We're happy to support it as well too. Thank you.
Okay, members, that has been proposed and seconded, and everybody's in favour, so we'll move on. There's no further indicated people wanting to speak on open for information papers. So can I get a proposal and second to go on to confidential, please? Councillor Deeney, Alderman McMorris, we'll just take a wee minute till we get the IT stuff organised. Thank you.